We present a video on Plasma-Kinetic Vapo-Enucleation of the prostate by a modified Nesbitt technique. From Global Rainbow Healthcare, Agra, India. There are various advantages of using plasma-kinetic technology in transurethral resection of the prostate. It uses bipolar energy with lower cutting current, which leads to lower tissue penetration. It generates a corona of plasma between electrode and tissue with better hemostasis, less bleeding, less tissue charring and minimum risk of absorption in TURiS syndrome. This is a virtually bloodless procedure with catheterization times of less than 24 hours and excellent hemostasis. There is no need to stop anticoagulants, and the learning curve is flat as it closely mimics monopolar transurethral resection. We did a study to assess the feasibility of plasma-kinetic energy for vapo-enucleation of prostate using the Nesbitt technique for BPH. In total, 35 patients with obstructive LUTS and BPH were selected. We used a 26 French continuous flow Iglesias resectoscope with a 30 degrees lens and a video camera. A button-shaped electrode was used for vapo-enucleation, followed by a bipolar resectoscope loop for final resection. An Olympus bipolar generator supplies the energy for vaporization. Warmed saline, preferably to body temperature, is used as the irrigant. These are the various instruments used in the procedure. This is the depiction of Nesbitt's technique of monopolar TURP. The Nesbitt's technique is followed for vapo-enucleation. Initially, cystourethroskopy is performed to assess the size of the adenoma and the landmarks like bladder neck, verumontanum, and both ureteric orifices. Following this, an incision is made at 12 o'clock position with either button or cutting loop till the capsular fibers are identified. Next, the button is progressed to the right lobe from 11 o'clock position down to 7 o'clock, sweeping along the capsule and enucleating the right lobe, which falls medially. Constant pressure is applied on the button over the adenoma to create a trough between the adenoma and capsule. The corona created around the button helps in vaporization of prostatic tissue, creating a plane between capsule and adenoma. As you can see, the complete hemostatic effect achieved with the button electrode. The hemostatic effect can be seen here. The right lobe is almost completely enucleated from the capsule and has fallen medially. Following this, similar process is repeated on left lobe from 1 o'clock to 5 o'clock position, enucleating the lobe medially. While proceeding with vapo-enucleation, we can vaporize the residual tissue attached to the capsule. Again, a constant pressure is applied on the button to create a plane between the adenoma and the capsule. While working on the left lobe, the trough is developed between the capsule and left lobe, sweeping down from 1 o'clock down to 3 o'clock, further down to 5 o'clock position. Enucleation of the lobe along the distal part, near veru, can be a bit tricky. Here, we can see both lobes enucleated and fallen medially, attached at the base, at 6 o'clock position. The capsular fibers can be seen all around with fair hemostasis. With both lobes enucleated and devoid of blood supply, they are quickly resected with a cutting loop into small chips which fall into the bladder. Any residual tissue left behind at the apex is mopped up. Following this, hemostasis is secured and resected tissue is retrieved. Here, the clear and open prostatic fossa can be visualized with complete hemostasis. Postoperative assessment was done at 1 and 3 months following TUR, post-void residual urine, IPSS score, Qmax. Immediate and late complications were recorded in the study. We recorded a mean prostate volume of 65.7 cc, with mean operative time of 55 minutes and mean catheterization time of 37.6 hours. We had good outcomes in terms of IPSS change, post-void urine reduction, and change in Qmax. We concluded that transurethral, plasma-kinetic vapo-enucleation of the prostate is a safe and effective method in management of BPH. The learning curve of this technique is flat, as it closely mimics the Nesbitt technique, which is commonly used in monopolar TURP.